Before discussing the Federal Motor Carrier Safety Administration's alternative vision standard, it's important to briefly review the normal vision standard. The driver must meet the standard in each eye, with or without the use of corrective lenses. For distance vision, each eye must have at least 20/40 vision or better. For peripheral vision, each eye must have a minimum of 70 degrees of vision in the horizontal meridian. Drivers must also be able to distinguish between traffic signal green, red, and amber. Drivers cannot be experiencing double vision. If corrective lenses are used to meet the requirements, they must be worn while driving. It is also important to understand the difference between monovision and monocular vision. Monovision is the result of using a corrective lens in one eye for far vision and one in the other eye for near vision. An individual may also have LASIK surgery to obtain the same result. This issue is generally circumvented by having the driver acquire new corrective lenses that allow for distance vision in both eyes. Monocular vision is defined as drivers who only meet the vision standard on one eye. If an individual does not meet the vision standard, they must be disqualified. When applicable, the individual can obtain corrective lenses from a vision specialist and then undergo a new physical qualification examination. If the individual's vision cannot be sufficiently corrected, the examiner should consider whether the individual may be qualified to drive using the alternative vision standard. The alternative vision standard is for drivers with monocular vision, meaning those who only meet the vision standard in one eye. With the alternative vision standard, the same basic standards apply, but only for one eye. However, there are some necessary steps to take before being medically certified to drive. First, the driver is required to have a vision evaluation report, Form FMCSA 5871, filled out by an ophthalmologist or optometrist prior to the examiner completing the physical exam. The questions on the form are designed to verify the diagnosis and the degree of deficit of the affected eye. The DOT physical exam must be performed within 45 days of the form being completed, or the vision evaluation report will be deemed invalid. The medical examiner reviews the completed vision evaluation report to see if it is acceptable to certify the driver. The ME will then perform a physical qualification exam, and if the driver meets all the other qualification standards, they can certify the driver for up to 1 year. The ME should check yes to monocular vision on the report form and attach the vision evaluation report to the medical examiner's report form. They can write "See attached documentation" or enter the information from the vision evaluation report into the medical examiner's report form. The ME must keep the vision evaluation report with their records. The first time an individual with monocular vision is medically certified under this alternative standard, they must complete a road test administered by the driver's employer. Most self-employed, owner-operator drivers have contracts with larger companies, and they can use them for the road test. Drivers may also turn to a CDL driving school to perform this test. Individuals that have 3 years of intrastate driving experience with the vision deficiency are not required to complete the road test. To learn more, visit teamcme.com and register for our online training.